Assalamu alaikum, hello and welcome. You're listening to me, Shazia, on the Nutrition Show on Unity FM 93.5 FM. Really excited to have you all join me today for a discussion on health and well-being. Before we dive in, I would like to remind listeners that all information shared on today's show is general in nature. For anyone with medical issues or concerns, whether they're related to today's show or otherwise, please be sure to seek medical advice from your own general practitioner. So today, I have the honour of a very special guest. An incredible lady who has been described as one of the West's foremost authorities on using acupuncture in helping people recover following cancer treatment. She practices in Wimpole Street in London and in Uxbridge, Middlesex. She is a professional acupuncturist with over 20 years' experience, having studied at the College of Integrative Chinese Medicine in Reading, Berkshire, and a Hospital of Chinese Medicine in China. Our guest holds the post of researcher in integrative medicine at Mount Vernon Cancer Centre in the UK's National Health Service. For almost 25 years, she has investigated the use of acupuncture for the supportive care of people living with and beyond cancer. A distinguished researcher, our guest lectures internationally and has many publications. She is the author of Acupuncture and Cancer Survivorship, Recovery, Renewal and Transformation. Hello and welcome, Beverley Du Valois.
Hi, Shazia. Thank you so much for this excellent opportunity to talk about my work to your community.
Hi, lovely to have you. We're absolutely honoured. Super excited and can't wait to dive into the amazing knowledge that you have to share with us today, Beverley. Feel very privileged to have you on the show, appreciating the time that you've taken out of your busy schedule. Your work is quite specific, and I was fascinated reading about what you do and how you support your clients. It was certainly a learning opportunity for me, quite an eye-opener. So before we dive in, and for the benefit of our listeners, would you mind sharing a little about your amazing journey to how you got to doing what you're doing today, Beverley?
Oh, thank you, Shazia. Well, it's been quite a journey of over 25 years. I guess that I had a midlife change of career, and I trained as an aromatherapist. And during that time, someone recommended a book to me about a woman's cancer journey. And while I remember very little of the book itself, I do remember exactly putting it down and saying, this is what I want to do. I want to work with people with cancer. So that was kind of finding my vocation, if you like, at a very early stage. I then I knocked on lots of doors, and finally the head of the Macmillan team at the North Middlesex Hospital met me and said, I want complementary therapies for my patients, and I was doing aromatherapy at the time, and so I started to work with that group. So I worked with patients in hospital, and we set up an outpatient service.
Wow!
But at the same time, I was training as an acupuncturist, and I really wanted to bring acupuncture to people with cancer. And when I finished my training as an acupuncturist, I was recruited by the Linda Jackson Macmillan Centre at Mount Vernon Cancer Centre in northwest London. I started there, and the intention, I was the complementary therapy coordinator, but the intention was that I should also deliver some of my therapy.
Wow, amazing.
But many weeks passed before I could do this, and when I pressed the management, they were quite concerned about, this was 25 years ago, and acupuncture was fairly new. They were quite concerned about a non-medical person delivering what they saw as an invasive therapy to their cancer patients. So I'm nothing if not persistent. So I pressed the matter, and the very wonderful medical director, Professor Jane Marr, said, well, if you want to have an acupuncture service for people with cancer, you need to do some research. So we only introduce therapies if they've been evaluated.
Sure.
So that started my first piece of research, which was looking at using traditional acupuncture to manage the breast cancer treatment-related hot flushes and night sweats.
Wow.
That women get when they, at that time, they were taking tamoxifen as the adjuvant therapy.
Wow.
So I finished that. We then went on, that had a good result. We then went on to do another study using ear acupuncture for those hot flushes.
Oh, wow.
That also had a good result. Those studies became the subject of my PhD, and I've been doing research ever since. So
amazing! Wow, I'm thinking what an influential book to get you started on that journey.
Indeed.
Wow, how amazing! And did you have a link? I know you said you were studying acupuncture, but was that kind of related to the cancer kind of combination, if you like, or was it kind of independent when you first started?
It was quite independent of that. When I trained as an aromatherapist, the school taught aromatherapy according to the principles of Chinese medicine.
Sure.
And I was quite fascinated by that, so I wanted to do more of that. So it was nice that they just converged.
Yeah, that sounds really amazing, doesn't it? How it all kind of just sort of fit together for you. And I find that really incredible sometimes. I mean, I love listening to those stories because they're so inspirational, and it makes me think maybe that'll work for me one day as well. Amazing.
Well, I think the thing is, it never feels like it when it's happening, but when you look back on it, you see how it's together. Yeah.
Absolutely. I love that. So amazing. Wow. And how unique as well. Gosh, I'm really looking forward to hearing more about how you work, Beverley, and the results that you see, because that's kind of really incredible in and of itself, isn't it? I'd love for you to share a little bit about how acupuncture, what acupuncture actually is for those of us who kind of maybe perhaps new to it, and how it works, just to those who are not familiar with the process and the therapy itself, and so that they can learn a little bit more about what it does, how it actually works. Please.
Okay. Well, acupuncture is believed to come to us from China. It certainly comes from the Far East.
Sure.
It's used in China and Japan and Korea and many of the countries, Taiwan, many of the countries in the Far East. And in many of those countries, it's part of their mainstream medical service. It works very well alongside conventional medicine. So in many countries, they have a dual setup where you can have both of those styles of treatment.
Amazing.
Acupuncture is generally associated with it's a needle therapy. It's the insertion of very, very fine needles just underneath the skin, and it's certainly from the Far Asian model, the traditional model. It's this idea of there are channels or meridians running through the body.
I see.
That kind of conduct energy through the body, and along those channels are areas where the energy kind of pools. Those are called acupuncture points.
Oh, wow.
And that's where we tend to insert a needle. And we use this to kind of send a message to the body that maybe it could be behaving differently, I think is a good way to put it. So it's kind of transmitting a message to the body to say, you've been behaving this way, but let's try behaving this way, and maybe everything will work better, I think is a good way to put it.
Okay. And would you say it's kind of a blockage of energy at those points, or is it, I know you use the word pooling, but if we were sort of to imagine, us as kind of beings that have this energy flowing through us of all sorts, and is it kind of tackling a blockage as such, or is it just to kind of support that flow? How would you describe it?
Many things can happen. So those acupuncture points are just a good place to access the energy. They're a good place to contact it. It's easy to contact there. There are many in the whole kind of theory of Chinese medicine. There are many types of energy, and many things can happen to it. So some energy gets blocked, and then you want to release that and smooth it. Sometimes there just isn't enough energy there. We call that a deficiency.
Sure.
You want to encourage that to develop and grow so it can nourish the body properly. You have, and sometimes you have too much energy in a place and you want to release that. So lots of things can happen.
Oh, wow. That's really amazing. Really interesting.
Kind of people who study Chinese medicine acupuncture in the UK train for over 3 years. So it's a full medical system. It's complex, and so it takes a long time to understand that theory and understand the interactions.
Wow, sounds really quite in depth. Wow, yeah, amazing. I love that. So, in terms of kind of the experiences, perhaps the challenges that you find patients presenting with following cancer treatment, whether that be chemo, radio or surgery, what would they kind of identify as? How do you see them, Beverley? Like,
when people have treatment for cancer, when they're diagnosed and treated for cancer, they're often given a cocktail of interventions that might be any combination of surgery, radiotherapy, and chemotherapy, and adjuvant hormonal therapies, and nowadays more and more there's immunotherapies.
Sure.
And so these are very effective. They're very good at containing the cancer. They're used with curative intent.
Sure.
And they help people go into remission and live well, or hopefully live. But often they're very hard on the system, and it depends on kind of what kind of cancer and what kind of treatments people have. But they can be very, very hard on the system. So a person comes to the end of their cancer treatment, hopefully in remission, but they may not be feeling well. They've really had the stuffing knocked out of them by their curative intent treatment.
Sure.
So this can be just as simple as just not feeling themselves, or it can be much more complex. So people might have side effects of the treatment. People with chemotherapy might have a condition called chemotherapy-induced peripheral neuropathy, where they have unpleasant sensations in their hands and their feet, and that is very troublesome for them. It might be related to the adjuvant hormonal therapies. Women and men, women with breast cancer and men with prostate cancer might be taking medications for a long time, up to 10 years after their initial cancer treatment. And that might make them they might have hot flushes because of that.
Gosh.
So this is some of the specifics, but there's also lots of things. There's lots of emotional problems. People might feel anxious. Fear of recurrence is really a big and powerful problem for people with cancer survivors. They see all of their symptoms maybe as being a warning that the cancer is returning, when in fact it might not be. So, but they get very distressed about that.
Of course.
So there's lots of emotional and physical issues that we see, and these can continue. You know, it's generally reckoned, the rule of thumb is that for the first year after treatment ends, people might be feeling, they might be dealing with the after effects of their treatment.
Sure.
And hopefully then those symptoms will disappear, and things like fatigue and things like that. But for some people, they will continue, and they might continue for a long time.
I see.
So you really want to have some way to help them to feel better.
Of course. And I guess it's like you mentioned, it depends on the type of cancer they've had and the treatments that they've had. And I would imagine if they've had more treatments, perhaps they have more problems as well, side effects and things, or does that vary?
Yes, but it varies,
Sure.
but I mean, surgery, surgery can be devastating for some, if it's a small, I don't really like to compare the cancers, because no cancer is nice, but it's quite different for a woman having breast cancer surgery, where the surgery is located in the breast. It's quite different from a head and neck cancer patient who might have, who might have had their tongue replaced with what they call a flap that's taken from the skin on the arm or the leg, and so that makes a difference to whether they can eat, how they talk, how they feel. So even just within surgery, it can vary very, very much according to the type of cancer.
Amazing. Yeah. Gosh, it's quite a range there, isn't it, of what you might then be presented with in clinic. That's indeed, amazing. Yeah. So following on from that, Beverley, please would you tell us more about how acupuncture benefits patients who have completed cancer treatment? And is this the same for those who may be undergoing treatment as well, so perhaps or in the active phase of treatment?
Okay, well, there are some similarities. So, acupuncture can be used at any stage of what we call the cancer pathway. So at any point from diagnosis
Sure.
To many years after the cancer treatment has finished.
Okay.
The needs slightly vary. Someone who's undergoing active cancer treatment
Sure.
might be suffering from, if they're having chemotherapy-induced nausea and vomiting is often associated with that. So acupuncture can help as an intervention to help that.
Wow.
But that would disappear when their chemotherapy stops.
Sure.
So it wouldn't be an issue in the long term. So that's just one of the differences. So how does it benefit people who've completed cancer treatment? Well, this is where I see a lot, and I think the before I focus on specific symptoms, I think one of the things that I found in my many years of research and working with patients is that what it does is it helps address the trauma of that cancer experience.
Wow.
So it's very traumatic to have a cancer diagnosis in itself. That's a life-threatening condition.
Sure.
But the treatments are, as I said before, very hard on the body. So there's a lot of trauma, there's a lot of uncertainty. And when they get to the end of the cancer treatment, there's still not really the certainty that they would like, because we don't know if the cancer have they really gone into remission, if the cancer is being contained. So, but what you can do is work with patients to help them absorb that trauma and to help them cope better with their cancer diagnosis and treatment. What I found very important is helping people to restore their resilience. Again, through their cancer treatment, they've taken a real knock to their system. They've kind of lost their bounce, their resilience, their ability to bounce back from life's what life throws at them. And acupuncture treatment is very good for helping this. And we found that it helps people to adjust to their diagnosis, to become more motivated, and to really look after their own health better, which is what we really want long term for people, for everybody. Really.
Absolutely. Wow.
But what we but I think people, that's a kind of general concept that people aren't accustomed to. What it can do is help manage many of the symptoms. So some of the things that we see is acupuncture can help people recover more quickly from from chronic fatigue that might happen after cancer treatment.
Sure.
But again, that's one that's useful while people are undergoing cancer treatment as well. These things are very draining. They make people feel very, very tired.
Sure.
And cancer, one of the things that people say so often when they've had acupuncture is, I have so much more energy now. I just feel so much more energetic.
Wow, amazing.
So that's really important. It can help, again, to manage hot flushes and night sweats. This is a common side effect of treatments for particularly breast cancer and prostate cancer, so for men and women. And those are the two most common cancers really in the UK and in the Western world. So there's a big pool of people there who might be suffering from those things.
Amazing.
But I think the important, so there are individual symptoms, physical symptoms. Acupuncture can also help people to sleep better. And I said about the energy. And it can also, again, another common physical symptom is pain. People might have post-surgical pain or pain after radiotherapy.
Sure.
And so it can help to address pain. And this is becoming more and more recognized throughout the world. There's been a lot of research, and the evidence base for acupuncture is well enough developed now that many major organizations are now publishing guidelines saying acupuncture can be offered as an intervention for things like cancer treatment related pain, hot flushes, anxiety and depression, many things.
I think that's incredible. I mean, just to see that change in the conventional medical system and allowing people access to these therapies that now they're seeing the evidence for and offering these services. I find that I just find it mind blowing, because it's kind of where even in my own field of practice now, it's so early days that it becomes quite frustrating to see that it's not being made available via the the regular routes, if you like, into healthcare. And so I love the fact that, it's got to that stage where the evidence is there, it's presenting itself, it's becoming available and made available to people to benefit them. And I love the key words, I picked up key words of some of the things that you mentioned there, the resilience, the energy, the sleep. No pill's going to help someone recover in those ways, and those are all essential to health and well-being. We know that we talk about it all the time, even in the nutrition world. It's so, if we don't get those things right, we don't really get any success with change in someone's life. And I love all those words that you've used, and it seems just it just seems so miraculous in and of itself. And I'm just so pleased that this is available to people, and people today are learning that actually this is there for you and you can look into this. And I was watching a video on your website when I had the pleasure of meeting you via our business network, and I was blown away, and I thought, wow, this is just incredible. And there were physicians on there talking about the therapy, and I because I've never seen that in other modalities, not in the same way. I was like, well, this is just amazing. And I'm looking forward to nutrition also becoming the same kind of resource available to people in the same way at that kind of level in the future. Maybe not in my time, maybe in the future of others possibly, but it's life changing, isn't it? And of course, we're not providing medical advice here. This is about educating and empowering people with the knowledge that these services are actually available, and they're there to look into and to reach out and seek support on, aren't they?
Yeah. And there's two things that you've mentioned that I want to say, if
Sure.
I can remember. One, I think it's really important that acupuncture offers an alternative, and like nutrition would, it offers an alternative to medication. And many people who have been treated for cancer don't want to take more medication. So
Absolutely.
they don't want to take drugs to manage their hot flushes. And often, and some of the studies that have been done with acupuncture, they've put acupuncture head to head with some of the medications, particularly for hot flashes.
Wow.
And they found that the acupuncture is either as or almost as effective as the medications.
Wow, amazing.
But what happens is that you don't get the side effects of the
Sure.
medications. And when they stop the treatments, often when they stop the drug treatment, the symptoms come back. So the hot flushes come back, and they come back fast and furiously.
Sure.
Whereas with the acupuncture, there's a longer period before they come back, and when they come back more gently. So you get a lot of advantages from that.
Amazing.
And I said there were 2 points, and I completely I know what I wanted to say.
Amazing.
You said it sounds miraculous. And what I really need to make clear is often with acupuncture, it's a process. It's not
Sure.
a case of one treatment will fix your problems. Sure. It's a process, and I like to work with people as a team to help them, to support them with the acupuncture, and also to help them to find ways to improve what they're doing in their lives, rather as you do with nutrition.
Absolutely.
So that they are self-managing in a better way. That they take control of their life.
Sure.
And their health.
Absolutely. Yeah. I mean, the results are there to be had, but over a period of time. Yeah. Following a period of work, it's always something that is gradual, isn't it? So, absolutely.
Yes, it's a commitment. It's a commitment on the part of both the practitioner and the patient, I think, which it's really important to understand. It's not that they come in and they get a few magic needles It's that they enter a process
Of course.
that will lead to a transformation.
Sure. But it's, I mean, the fact that it's available and the results are there from other patients, it's empowering, isn't it? It's kind of
Indeed,
inviting people to say, look, this is there for you, read about it, understand. Because I think a lot of it is actually just knowing about services and knowing about modalities. And the research, as practitioners, we will dive into all the nitty-gritty and all the detail and all the complexities to make that available to people so that they can understand. And then we advise them about how that process is going to support them on a longer term basis. And maybe for people that you see, it's probably very similar to how we work when we do our nutrition clinics. Each person is individual. Some people need a little bit more time to reach a particular goal. Some people may reach that goal far earlier. It's always individualized, isn't it? It's kind of something
Indeed,
that you can never say you'll be there at this time on that day. It's never a case of that, is it? Even though we'd like that.
It's very frustrating for patients because they want to know, how much time and money they need to commit to these treatments, and it's impossible to tell, because as you say, everybody responds differently.
Yeah, absolutely. I love that. This has been so informative. I am sure that this discussion is going to be hugely educational to many listeners out there, including myself. We're going for a short break now. So you're listening to me, Shazia, on the Nutrition Show on Unity FM 93.5 FM with our lovely special guest today, Beverley Du Valois. We'll be back after the break for more, so please stay tuned. Assalamu alaikum, welcome back to the Nutrition Show. You're joining me, Shazia, on Unity FM 93.5 FM with our special guest today, Beverley Du Valois, a professional acupuncturist helping people recover post-cancer treatment. We'll be diving into more gems shortly. Just a reminder that our discussion is for information purposes only, so it does not constitute medical advice. For any health issues or concerns, please do consult with your own medical practitioner. Welcome back, Beverley. It's an honour to have you on the show.
And it's an honour to be here. Thank you.
Amazing. Thank you so much. So my experience in speaking to people with cancer, Beverley, especially with those who've had a diagnosis recently, is like looking at layers and challenges. So firstly, it's the diagnosis itself, which can be tremendously overwhelming, with many anticipating the worst naturally. But then this is also followed by the challenges of treatment and then what comes beyond. So with respect to acupuncture, how much hope does this specific technique provide for these people going through these kind of phases and a variety of experiences during this kind of journey?
Okay, well, I understand all those challenges and the difficulty for people who receive a cancer diagnosis and undergo treatment. I think the first thing that I want to make very clear is acupuncture is not offered as a cure for cancer. So that's really, really important, and I can't stress that enough. And if you come across a practitioner who says that they're going to cure your cancer, be very wary. It is actually against the law in the UK for a non-medical person to say that they can cure cancer. So
Sure.
It's really important to be aware of that.
Absolutely.
But what it can offer these people with a cancer diagnosis is support. Many people who are undergoing cancer treatment and have undergone cancer treatment, they're very, very grateful for their cancer treatment, but they feel that the focus is on the tumor itself, and
Sure.
so that healthcare professionals are really focusing on the tumor itself rather than the whole person. Now,
Sure.
I understand when they say that, but I think it's very good that the oncology healthcare professionals are focusing on the tumor, because that is where the problem lies. And they need to be able to focus on that.
Sure.
What's really good is if you can have additional healthcare interventions like acupuncture, which really look at the whole person and take a whole person approach. And so look at that person who is a person who happens to have a cancer tumor and is undergoing treatment, rather than a tumor that happens to have a person.
Oh, I love that analogy. Yeah, that's such a great way of looking at it, isn't it? Amazing.
Yeah.
I love that. So now that I was going to add. So now that we have a better understanding of sort of how we kind of see that individual and what they may be sort of experiencing, and realizing that they're actually a person and requiring holistic sort of support, if you like. Can you tell us a bit more about some amazing terms actually that we've had a discussion about ourselves as well? So survival and survivorship. Can you tell us a little bit more about what they mean and what they how they kind of present themselves in the actual sort of the person presentation?
Okay. So, so survival is a survival and survivorship. They're two terms that are often used, and survival is about how long a person lives after they've been diagnosed with a disease.
Sure.
It's not just cancer. This is the term that's used in the scientific and research community.
Okay.
Really to measure a problem or measure how effective an intervention is. So it's simply survival is really about surviving. It's about how long you live after a cancer diagnosis. And it's measured in years. Typically it's measured in 5 years and then 10 years. So that when you're reading the research or reading information, that is often what people talk about: 5-year survival, 10-year survival.
Sure.
And it's very good. In the UK and certainly in the Western world, survival rates have increased.
Amazing.
We have many more cancers. 1 in 2 people will have a diagnosis of cancer in their life. But the good news is that people are surviving longer after their cancer diagnosis and treatment. And that's due to better treatments, earlier identification of the cancer so that the treatments don't need to be severe, and new medications. So that's important.
Sure.
Survivorship is different, and survivorship is kind of the area where I work. Survivorship is more about the quality of that life. So how well people live in their longer years of surviving.
Sure.
So if you very simply, survival is about length of life. Survivorship, we can say, is about the quality of that life.
Wow.
And that's where I work with the acupuncture to try and help people improve their quality of life after they've been successfully treated for cancer.
Sure. I love that. That's amazing, because it's exactly how I work as well. So we look for, it's quality over quantity, isn't it? So we want to live longer, but we want to live well. It's not about sort of living longer, but struggling through those final years of our lives. It doesn't make any sense to want to live longer, but then having to, go day by day thinking, okay, this is another day like this. And it just doesn't make any sense, does it, to kind of expect people to live that way? And I love the way these holistic therapies allow people that, that, and I want to call it a right. I think it's a right of every person to live long, healthy, happy lives. And I think without it, what kind of life do we live? What kind of value can we give? We all have a gift to share in the world, and if we're not able to live longer, happier, healthier, there's no way we can share that gift in the best way. So I really love how you've kind of fit that all in, because it kind of resonates so well with the work I do, and it took me a while to see it.
So many patients, they have acupuncture in it, and so many have said, and we've collected this in research data, and people say it when they're having treatment. They just say, acupuncture has given me my life back.
Wow.
And people say that it's turned their lives around, that they've been able to go back to working full time, or they've found new meaning in their life.
Sure.
And in my book, in chapter 14, I've dedicated to the case study of a woman that I've called Anne, who really suffered for 8 years after her cancer diagnosis, and treatment with breast cancer treatment-related lymphedema and poor sleep, and she was overweight and she wasn't eating well, and her life was really, really challenging, and she had lost her confidence as well. And she was desperate. She was afraid of needles. She was a needle phobic. And she was really apprehensive about having acupuncture, but she was really also committed to finding a way of changing her life. And she had 13 acupuncture treatments, and it turned her kind of life round.
Wow.
And she's just such a, she had such a complex presentation, but it really made a difference to her life, and she regained her confidence. She got her energy back. She said she became the person that she was before her cancer diagnosis. And so for me as an acupuncturist, she was the patient I learned the most from in my entire 25 years of treatment. And she was kind of the inspiration for my book. And that chapter is dedicated to her. And I talk about her all the time because she's such a remarkable example of how devastating cancer treatment can be. She had her life, she had a long survivorship, she's still living now, but how much it took out of her, and how acupuncture helped restore her back to her former self.
Wow, that's nothing short of incredible. I'm like, wow, I'm just blown away. I think, to have such a drastic change in life and to go through something so big and then come out so well, I think that's just it's nothing short of a miracle, isn't it? It's just amazing. And it goes to show that there's so many more people who can learn about this and also benefit. So
Yes.
This is kind of amazing. Wow. So we're all unique, but if you had to think of 3 challenges, Beverley, you see as a practitioner working with your patients in this area, what would they kind of be for you?
I think I made some notes here. I think getting people, both cancer survivors and healthcare professionals, to understand the message around resilience. So really understanding that people get so focused on their symptoms, which is fair enough, but to understand that there's a wider, that acupuncture offers something wider and helps people to restore their resilience so that they can cope better, both with their cancer treatment or the after effects of cancer or just life in general. I think that a really challenging area, again, because we focus so strongly all the time on physical issues, but I think acupuncture helping people with the emotional consequences of their cancer diagnosis and treatment is really important. So addressing the fact that there's the trauma is there, and that people feel anxious, or they may feel depressed, they may feel grief. There's a whole load of there's a whole raft of emotional issues around cancer and cancer diagnosis.
Of course.
And so I think this is really important. And it doesn't need necessarily to have talking therapies. You can do this through the needles, through the acupuncture treatment.
Sure.
People often think that they're often referred for counseling, but they don't want to have counseling.
Sure.
And so it's really understanding that acupuncture can help to address these issues as well.
Amazing.
And I think the third one, I think the big challenge for people who've been treated for cancer is when that treatment stops, they need to adjust to what is called the new normal. So I think often there's this idea that if and people have in their minds, if I can just get to the end of this treatment, however grueling it is and however many months it takes, my life will go back to what it was before. And often that isn't the case, sadly, but acupuncture can help them make a transition to what that new state of being is after they've had this really quite devastating diagnosis and treatment that has a huge impact on their lives.
Of course.
That can help them to kind of come to terms with that and have a better quality of life after treatment.
Amazing. And those individual areas can actually be kind of, talked about for an hour each as well, can't they? They're so amazing and so in depth. I mean, I'm just thinking about kind of the mental health side of things and how that is such a massive area that, it requires so much support in so many different avenues. I mean, I know when I see patients and, when their mental health isn't in the right place, I know I'm not going to get the results that I want to see, because there's so much that needs to be addressed before you can get someone ready on a journey to improve their health via food, for example. So I can see how that could be a huge area in and of itself. And it's just so amazing though how beneficial acupuncture, could be in supporting that particular area. And I'm so glad it's being addressed. I love that. Just to kind of sort of, I mean, I could ask so many questions. I could just go on and on, because every time you speak, I've got another question. It's like, I've only got the hour, unfortunately, today. I would love to ask so much more, but if there were some general tips, Beverley, or recommendations or any pieces of advice, something that our listeners today could perhaps kind of take away in summing up the amazing information that they've heard, and maybe for the first time, like me, what would that be from yourself, please?
Well, I would refer people to my YouTube station to look at some of the videos, and there's a very short video about acupuncture and cancer survivorship.
Sure.
And it really talks about a woman called Valfia, and she says, if you have the chance to have acupuncture, have it. It can change your life. Wow. And it changed her life. So that's a minute, 2 minutes of a person's time to look at that and see her testimony. She talks about not liking needles, but really benefiting from acupuncture. And it's wonderful at the end. She just says, if you have the chance, have it.
Amazing.
So that's one. I would say that if you're undergoing treatment for cancer, ask your cancer center if they offer acupuncture. Because many cancer centers do offer acupuncture, so check that out with them. And often those services generally tend to be free, so that's a good way in.
Amazing.
And I think the other thing is that acupuncture can address the physical consequences of cancer and its treatments, but it can offer so much more to people. And that just goes back to, it can just help people recover their resilience and their sense of self. And so many people, I always say acupuncture transforms lives. It transformed my life. I had acupuncture and I became an acupuncture on the back of that. I became an acupuncturist on the back of that. So acupuncture has given me my life back, is what so many people who have had acupuncture after cancer treatment have said.
Wow. So such few words, but so incredibly powerful. Wow. It's like, if someone can say that, it must be something really, worthwhile to look into. It must be, I mean, what's the harm in finding out? I mean, to know about this and to have that, as a piece of knowledge. I mean, considering, and it's sad to say that we're seeing more and more people now with the diagnosis of cancer than we ever did before. I know when I was studying at college, the kind of the stats were showing more than 1 in 2 people. Unfortunately, we're seeing more and more people with cancer diagnoses. So, being knowledgeable, understanding that these therapies are there, it just only equips you in case that you might need this in the future. God forbid, it's there for you. And if you know someone, you can also, you can share this information with others, which is, I think, really key. You never know who you can help. That's what I always say. You never know who might benefit from the knowledge that you gain and you may hear today.
And from a survivor's point of view, I'm treating a young woman with breast cancer at the moment, and she's still going through treatment. But she says to me, 2 things. She says, acupuncture, I feel such joy after I've had acupuncture.
Oh, wow.
Which is really, really nice. But she also says, this is something I do for myself. This is something I choose to do for myself. the other stuff I know I have to have, and I go to those appointments. But this is another appointment in my busy schedule of appointments. But it's something I choose to do for myself.
Absolutely.
And like she said, it gives me such joy.
Oh,
yeah.
That's such a nice way to put it, actually. And coming from someone in that position, it makes you, those words are always powerful, I find, because they're actually coming from the heart, aren't they? They're coming from the actual experience of the person. So, we can talk as professionals sometimes quite endlessly, and, we don't seem to get word out to people effectively enough. And that's why I find patient videos very, very effective in supporting clients, is because they're seeing it from an actual real life example of someone who's had something similar or is on a similar journey, and they're describing their experience. So, I would say to everyone that, this is worthwhile looking into. I was very pleasantly surprised when I learned about this, and like I say, it's new knowledge for me, and there's no doubt I will go and look into more about it when I next do some studying on it. And I think it's something that we all need to learn about. I think knowledge is power. It's kind of, I don't think we're in the kind of the time now where we can say, oh, I didn't know about it. It's kind of going out and seeking that knowledge, being proactive. And I think that's how my work in nutrition is different now as well. It's about being proactive rather than waiting for something to go wrong and then dealing with it. Prevention is always better than cure. And we know that time and time again, don't we? So,
but usually we learn that
the hard way, don't we? I know.
Can I just add one thing?
Yes, of course.
People often think that acupuncture is scary because it uses needles, but it really, I'm a needle phobic, and I have had.
Wow, really?
My first acupuncturist said, after about 2 treatments, she said, "Do you really think this is the right treatment?"
Oh, wow!
You're so afraid of the needles. So it's I'm much better with needles now. But it really shouldn't be painful. And many of my patients, you put the needles in and they fall asleep.
Wow.
So it's a very
Amazing.
relaxing treatment. Yeah. So again, if your listeners look at my the short YouTube videos
Absolutely.
on my site, and they'll hear these patients, many patients talking about how pleasurable it is to have acupuncture, even though they were very afraid of it. They had it, and then they just find that really it's very easy and not painful at all. So
absolutely,
I would encourage your readers to or your listeners to look into it, because it's
amazing. It's not like having a blood test, is it?
No, because you're not doing the same thing.
So it's not the same thing.
No, the needles are very fine. We're not putting them into veins or anything like that. So yeah, it's a different sensation.
Absolutely.
Yeah.
This is a definite must read and definite must learn, I think. It's amazing. It's been a real honor to speak with you today, Beverley. I really appreciate the time that you've taken to join us and share your amazing knowledge there, your wisdom. I can see from the way you speak how passionate you are about the work that you do, and the stories. I mean, I've seen them and they're incredible, and I think people really should take the time out to look into this information. And like I said, you never know who you might be able to help. For everyone listening in, I hope that what you've heard today has been insightful and gets you looking into what could work for you and your family, your health, while seeking support from your own medical provider. I would love to hear your thoughts, and feedback is always appreciated. You're joining me, Shazia, on Unity FM 93.5 FM on the Nutrition Show. Grateful for another opportunity to connect with you. Take care until next time. Wassalamu alaikum.